Greetings, everyone. This is Dr. Jennifer Teal here with a brief demonstration on how to look up diagnosis codes using the ICD-10 CM codebook. So I am using the Optum version of the coding manual. There are many different versions out there, but the basic pretense of how you use these coding manuals is essentially the same. One thing you want to do first is you need to understand the layout of the actual book itself. If you plan on taking any of the coding certification exams, for example, the CCA, CCS, or CCSP through AHIMA, those are timed exams, and they do require that you use your physical hard copy of the coding manuals. At this time, they are not using any kind of electronic encoder products or anything such as that for the coding exams. You have to have your actual code book. And if you're fumbling around using the book, that's going to eat up a lot of the time because it does go by very quickly. So I just want to give you an overview of using your code book. I'm not going to go through all of the coding conventions and guidelines and all of that in this video. This is just a demonstration on using the book to look up the codes. So in the front, the dark gray in this version of the book, this darker colored gray is where your guidelines are. And the coding guidelines are usually found in the front of most versions of a code book. You're going to refer to these guidelines often. And I encourage you to, whenever you're coding from a specific chapter in the tabular list, that you refer back to the chapter specific guidelines just to ensure that there isn't anything relevant to the case that you're coding. It's important to get into the habit of checking those guidelines often. So refer back to them often. After the guidelines, which is the darker color here, we have our alphabetic index. Now with ICD-10-CM, the alphabetic index is always your starting place. You always start from the index. However, you never code directly from the index. There are times when the index may provide you what appears to be a full code, and there are times when it provides you a partial code. So a case like this where I'm showing here, there's this little, there's a tiny dash after that last character there, and then there's this little checkbox. And this is a little visual cue to you that this is not a complete code. So this would never be accurate to use because additional characters are required, one or more characters. That's why there's this checkbox here. You have to check the final code in the tabular list. But you always need to verify your code in the tabular list because even if it gives you a full code, you need to go over there and you need to read the chapter guidelines that are at the beginning of the chapter. You need to read any instruction notes, any things like code first, code also, use additional code, includes, excludes, things like that that are going to be found in the tabular list because those instructions are not in the alphabetic index. So from the index, that's your starting point. And after the index, so all of this gray area is all index, right? All index. And then when I get to these colored pages, these are my different chapters of the tabular list, okay? So learn how to just quickly flip through to find what you're looking for. Now, what we're going to do today is just walk through a couple of case scenarios to get you familiar with how to use your alphabetic index and your tabular list for the coding process. I have a couple scenarios shown on the slide here that we're going to walk through. The first scenario is acute upper respiratory infection with influenza. So as a coder, you have to figure out from the diagnostic statement, so from the contents of the medical record, what pieces of information do you pull out in order to accurately code that condition? So we have a lot going on with this one statement, acute upper respiratory infection with influenza. So we know there's an infection going on. So more than likely, the infection is going to be the main term that we start with in our alphabetic index. So I'm going to go over to the I's for infection, and I can see at the top of my page, I can see what is the content for any given page, so I can quickly just jump around until I find where the infection is. So I found the eyes, and let me back up a little bit here. So I'm on infection, and I want to find where the beginning of infection starts. So with your alphabetic index, your main terms are always in bold print, and they are flush left. So flush left of the column that they are under, right? Because there's 3 different columns per page. So when I say flush left, I don't mean all the way flush left of the page. I mean flush left of the column. So bold print and flush, infection, infection, infected, infective. So any of those terms. And then what is indented below that is what we call a subterm. So use the bold print to help you find your main terms. So you can just jump from bold to bold to bold as you're looking through to find the actual main term. And then for subterms, they're indented under that main term. So this first kind of light, it's a very light gray color. It's a vertical line that goes down the page. That helps align those subterms, because all of this applies only to this infection, because that's the main term that we're under. And some of these subterms have additional subterms. So that's where this line comes in handy, because if I wasn't looking for something that is with, I could just skip over all this indented stuff and continue down this line and look for the next subterm. And that's helpful when there are some that are very long. So like bacillus is a little bit longer. If I knew it wasn't bacillus, I don't even have to bother to read all of these additional subterms. I just keep following this gray line until I get to the next one. So I am looking for acute upper respiratory infection with influenza. So it's an infection, and it's an infection of the upper respiratory tract. So respiratory is going to be my subterm, okay? So I can quickly flip and see by that gray bar, I know what letter I am in under infection. So infection at the top of the page, I'm only in the H's. Here's the T's, so I can back up a little bit. Here I see respiratory, but notice it says continued. That means it started on the previous column. So I want to go to the beginning of where it actually began. So over here is where respiratory starts. So I have an acute upper respiratory infection that is due to influenza. Acute upper respiratory infection with influenza. So if you can see that, and I can come down a little bit closer since it's at the bottom of the page. A couple things that I want to show you here. So we have respiratory, and then in parentheses, the word tract. Anytime you see that in parentheses, those are what we call non-essential modifiers, meaning that the presence or absence of those terms does not change the code. So the provider might have said respiratory tract, and if he only said respiratory, either way, it's fine, because this is a non-essential modifier. So I have influenza. Remember, I'm under influenza as my main term. If I go up to the top of the column again, you'll see infection. I'm sorry, I said influenza. Infection as my main term, and then respiratory. And then I'm looking for influenza. So be careful that you don't just stop at the first thing you see, because the default code is the one that's right next to this subterm. And that's when it's just a respiratory tract infection, NEC, not elsewhere classified. We have acute. Now, our case said acute upper respiratory infection with influenza, but I don't want to stop at this one, respiratory. So I just have infection, respiratory, acute, but this doesn't specify the piece about the influenza or the upper respiratory tract. So if I go a little bit further, you can see influenzal, and notice that upper is one of the non-essential modifiers. So by going down this path, I have found my respiratory infection, that's with influenza that is acute and that is upper. But it doesn't give me the code. Instead, what it gives me is a cross-reference. A cross-reference is when it tells you to go somewhere else. So that's what this C is. C, influenza with respiratory manifestations. So this is a good point here. Sometimes there's more than one way to arrive at what you're looking for in the alphabetic index. We went infection first, but we could have gone influenza first. And that's exactly where it's sending us. It's saying C, influenza with respiratory manifestations. So that's where we go next, influenza. So instead of infection, I need to turn my pages until I find influenza. And here we have influenza, if you can see that, influenza. And then we're going to be looking for with respiratory manifestations. So influenza with respiratory manifestations, because that's what that cross-reference told us. And here we have J11.1. Now with your codes, it's very important that you do not mix up your letters and numbers. So when you're writing these out, make sure that you write your 1 so that you can tell the difference between a 1 and an L and an I and so on. Make sure you do your zeros so that you can tell the difference between a 0, they have a little crossbar in the zeros, versus an O. So here's an O over here. So don't mix up your letters and numbers, because if you do that, your code will be considered incorrect. So here we have J11.1. Now remember, we never code from the index. We always verify in the tabular list. So now I'm just going to verify that. You're going to have a piece of scratch paper and you're going to write out whatever you find in the index. And then you're going to flip over to the tabular list. So let's go look for J11.1. Now these chapters are arranged alphabetically by the first character of the chapter. Okay, so as I flip the pages, you can see up here where the letters are. So I can easily flip, and I'm looking for the J's. So we're just going to look until we find J. Here's my J's. So it's going to be all of our yellow pages, and it says chapter 10. So that's what chapter of ICD-10 I'm in. So remember, I told you, whenever you're coding from a chapter, go look at those chapter specific guidelines. This is how you'll know what chapter you're in, because it tells you right here, chapter 10, diseases of the respiratory system. I'm looking for J11.1. And here we have the J11s. So another indicator for us are these red boxes here that have a little check mark. I know that's pretty small. So I'm going to zoom in a little bit here so that we can see. Sometimes it says check 4th, sometimes it says check 5th, check 6th, check 7th, depending on what character it needs. So this is a 4 and this is a 5. So this is the category. That 3 characters is a category. So I'm in the category influenza due to unidentified influenza virus. And it's telling me you need another character. Well, when I get to the 4th character, this particular one is telling me, well, for this one, you actually need a 5th character. And notice they indent every time, just like the index did. So anytime you have this here, you're not at a complete code. You have to add a character, and your character choices are usually indented just below that. Now, what our index told us was J11.1. Influenza due to unidentified influenza virus with other respiratory manifestations. And here, one of the, what it includes here is influenza with upper respiratory symptoms. So that is our acute upper respiratory infection with influenza. And then we have some instruction notes. So the instruction notes are in red in this particular version of the book. Use additional code for associated pleural effusion. So if applicable, that means if our documentation supports that there's also a pleural effusion, we're going to add this code. Our scenario did not say that. If there's associated sinusitis, use additional code. and then it's telling you where to go refer to find that code. So that's why you always come here and verify in the tabular list, because you need these instruction notes. You also have your includes and your excludes. So excludes 1, intestinal flu. So if this was influenza due to unidentified influenza virus with GI manifestations, this is telling us, wait a minute, that code actually excludes intestinal flu. And what you're going to do, instead of coding it here, you're going to go code it over here. So that's what that excludes 1 means. You don't code it here, you go and you code it here instead. So these are some of the things that you're going to find in the tabular list. So that was acute upper respiratory infection with influenza. Now, the next scenario that we're going to do is meningitis due to salmonella infection. And we have another case where we could either go infection, salmonella, or the condition itself, which is meningitis. So either one of those is probably going to lead you to the correct place. So let's first start with meningitis. So let's go back to our index, and I'm going to zoom out just a little bit so I can show you more of the page so we can see where we're at again. I'm in the S's. I need to be in the M's for meningitis. And so I'm going to come over here to the top and just kind of flip. This is how I flip. It's easier for me. And I'm looking for meningitis. So here I'm pretty close, and there's my meningitis right there. Okay. So quickly flip, and I can see in the center of the page, let me get the pen here so it's easier, meningitis. Okay. So we have meningitis due to salmonella infection. And this one has a whole bunch of non-essential modifiers. So if any of these terms are present, it's not going to change the code. So I'm looking for meningitis due to salmonella infection. So if I go meningitis, and then I need to look for the salmonella, so let's use this gray line to quickly guide us to the S's, okay? So I'm not in, and in salmonella, see, there is an option there for salmonella, A02.21, but I could also find salmonella right here, A02.21. You see, it's the same code. So remember, I told you that sometimes there's more than one way to find the entry that you're looking for. So meningitis, salmonella, right there, A02.21. Now let me show you if we went to infection, because remember, there's sometimes we can go multiple ways. And this just goes to tell you that if you're having a hard time finding something, maybe rephrase it. Maybe you have the wrong main term. So play around with it and try and, become accustomed to thinking like the index. So how are things arranged in here? So let's go again for infection. So I'm going the wrong way. I can't talk and say my ABCs in my head at the same time. So infection, if I go to infection, then let's look for the salmonella, because that's the infection. The meningitis is not the infection. The salmonella is the infection. So I'm going to go infection, and I'm going to look for salmonella. I'm in my P's. So again, infection, salmonella. And then I need to figure out the meningitis piece. So that's not a non-essential modifier. With meningitis isn't listed there. A localized, so it would be, the meningitis would be the localized type of manifestation for the salmonella infection. So there we go, salmonella localized, and then we have meningitis right here. And it's the same code, A02.21. So again, more than one way. So what we're going to do, We're going to write that down on our scratch paper, and now we're going to look for those A's. And I'm showing you now the bottom of the page. So I was showing you the top of the pages earlier to flip through, but notice it's also at the bottom of the page. So just whatever works for you to quickly navigate around these pages. And I'm looking for A02. I stopped it because I saw the zeros. A05, A00 to A05. And so one thing, whenever you're in a chapter, so here I'm in chapter 1, you see here, chapter 1, certain infectious and parasitic diseases. We have some chapter specific guidelines at the very top of the chapter, at the very beginning of the chapter. And so these guidelines here would apply to anything that is found within this chapter. Okay. And then, so you're going to review those, and then we're going to look for 02.21. That's what we wrote on our piece of paper. And that's localized salmonella infections. And again, here's that little indicator telling me I need an additional character. So A02.2 is not a complete code. I need another character. So here I go, salmonella meningitis, A02.21. That's how I get to my final code. There's no indicator that additional characters are needed. There's no instruction notes here for me to follow, so I'm comfortable that this is my correct code. So that's how you code that one. The next one we're going to walk through is amyloid heart. Okay, so we're going to go back to our alphabetic index, and we're going to go to the A's. Okay, so all the way to the A's. And let me just go to my pages again here and see if I can quickly find the A's. Up at the top, I'm a little off screen here. And we're looking for Amy, A-M-Y. So I'm at the A-M's, and I just need to find the Y. And I can use all of those bold terms. That's what we're looking for, to just jump around. And here we have amyloid, and the whole term in this case is amyloid heart altogether. That's the name of this specific disease. Now, what we have here is an example where you have an etiology and a manifestation code. So we have the first listed code that you're going to use, followed by the additional code in brackets. And what this tells us is a sequencing order. That code in brackets is always going to be sequenced after that primary code. So for this case, in order to fully capture the condition of amyloid heart, we must use both of these codes. So 2 codes are required to fully capture it. And you'll notice that also, if we use amyloidosis in heart, that leads us to the same thing. Again, a word of caution about your letters and numbers. This is actually an I43, not a lowercase L. So the book uses capital letters. Remember that. It uses capital letters to help you not confuse your letters and numbers, because that could easily look like a lowercase L. That is an I. So we need, on your scratch paper, write down E85.4 and I43. Those are the 2 codes we need to fully capture this particular condition. Okay. And so we'll go over to the E85.4 first. So again, let's go and do our little flip through until we get to the E's. And we're looking for E85. I went a little too far. E54. We're getting close. E79. Here we go. 85 to 88. We need 85.4. So it's going to be on the back side of this page, right? So here we go. E85. I'm looking for 85.4. So here we have the 85s right here. E85, and again, that's telling me another character is needed, and I wanted E85.4. Oregon Limited amyloidosis. And what we need to do here is look. So here's a definition. This book also sometimes give you definitions. Conditions of diverse etiologies characterized by accumulation of insoluble fibrillar proteins or amyloids in various organs and tissues of the body, compromising vital functions. So it's nice to have that definition to help you understand a little bit. And here we have our organ-limited amyloidosis. Now, the reason that we need an additional code is because this doesn't tell us what organ. So notice that it doesn't tell us what organ, and that is that's why I bet they have us using the I-43 as an additional code to specify that. So if I go over to the I-43, because remember the index told us that we needed that. And this is another reason why you got to start in the index, right? Always start in the index and then finish your coding in the tabular list. So I go E85.4, and now let me go look at the I-43. So I'm going to go over to the I's, and I'm going to look for I-43. And we're getting close. 44, 41, 42, 43. And this is your cardiomyopathy in diseases classified elsewhere. And this one here has a nice little code first. So that code first is a sequencing guideline. Code first, code first. That means that whatever that other code is has to go first, and this one would go second. So code first the underlying disease, and there's our amyloidosis right there. So the E85. So that goes first, followed by the I-43. Code also is not the same thing as code first, okay? So use additional code is a sequencing guideline because that's telling you that the additional code goes second. Code first is a sequencing guideline that tells you that that particular code goes first. Code also, that is just that more than one code is required, and the sequencing is going to depend on the circumstances of the encounter. So code also is not a specific sequencing guideline. Code first and use additional code, those are sequencing guidelines. So these two codes we would use together. Now, get into the habit of writing your codes out so that you can tell your letters and your numbers. That was one of the tips today. And also with ICD-10-CM, a lot of times when you use encoders and they're showing you the codes, they tend to not show the decimal point because they're going to be dropping codes directly into the hospital's payment system. We're not like writing them out or anything like that. So be careful when you're using the encoder products for any of your coursework or your assignments where they don't show you the decimal. If you're putting these codes into your test questions, if you leave out this decimal point in any of your ICD-10-CM codes, that code will be considered incorrect. So get into the habit of writing that decimal place in there. If you're using an encoder for coursework, it's helpful to verify in your book. Look it up and make sure that you're writing it out correctly. Make sure if you need to, when you're writing your ones out, write them like that so they look like a one. When you're writing your zeros, write it like that so you know for sure that that's a zero. Make sure that you're doing capital letters so you know that an L is an L and not a one. Things like that will help you so that you don't confuse your letters and your numbers, because ICD-10-CM uses them all. So you don't want to be mixing them up. You don't want to be mixing up 2s and Z's and 5s and S's. So make sure you write them clear enough so that you can tell the difference. So with that, I'm going to go ahead and end this little demonstration. I hope that helps you navigate your way around the code book and the coding process itself. And with that, I'm going to go ahead and end this recording. Thank you for your time and attention.